Good evening, everyone, and thank you for being here virtually tonight for the panel on children's mental health during the COVID-19 crisis. Some of you may or may not know me. My name is Trenny Kusnerick. I work for NBC Sports Boston. I'm actually in our studio right now. I just finished our show from 6:30 until 7:30, but I'm also a fierce advocate for mental health, better coverage, better access, and for kids, adolescents, and adults who are struggling with the stigma of mental health issues. I'm also a proud member of Franciscan Children's Board of Overseers. I'm thrilled to be moderating this evening's panel, where we will be answering your questions about how the pandemic is affecting our kids' mental health. Today's kids are facing a mental health crisis. 20% of children have a mental health condition, and suicide is the second leading cause of death for children between the ages of 10 and 24. Unfortunately, the pandemic has only added more challenges. Stressors like the recent uptick in COVID cases, the uncertainty of reopening schools, the effects of being at home for long periods of time, and parental unemployment are all contributing to the mental strain our kids are experiencing like never before. Experts at Franciscan Children's are working to combat this crisis. You may know Franciscan Children's as one of the leading pediatric mental health providers in New England. In partnership with McLean Hospital, they offer individualized mental health services ranging from inpatient and outpatient to school and community-based programming designed to reach local youth and educate the community about pediatric mental illness. Their research partnership with Harvard University uses cutting-edge technology and methods to improve detection and treatment of pediatric mental illnesses. Tonight, we're going to hear from those experts in the field of pediatric psychology, counseling, and mental health research from McLean Hospital, Harvard University, and Franciscan Children's. They're going to share their insight on the youth mental health crisis, the effects of the pandemic on our kids, and most importantly, what we can do about it. But before we begin, I'm just going to run through a few quick housekeeping items. This session is being recorded. A link will be emailed out to you. If for some reason you have to leave early, or of course, if you want to share it with someone who may benefit from tonight's information. We also received an overwhelming number of questions. So we're not going to be able to address each one this evening. We will follow up though with you with resources for those questions we aren't able to get to tonight. We're going to begin with the questions you submitted when you signed up, and we'll also take live questions if time permits. Please use the Q&A. There's a menu at the bottom of the Zoom screen. You can use that Q&A menu button to submit those questions. Questions will only appear to us, the panelists, and they will be anonymous, so please ask whatever you would like. We're pleased also to have some special guests in the audience tonight. Dr. Jim Mandel, former president of Boston Children's Hospital and board chair at Franciscan Children's, as well as Josh Nash, president and CEO of Franciscan Children's. We thank you very much for being here virtually tonight. It is now my pleasure to introduce the people you all came here to hear from this evening, our esteemed panelists. Dr. Ralph Bonapane is the program director of the McLean Franciscan Child and Adolescent Inpatient Program, which is a place of hope and healing for children in psychiatric crisis, offering expert crisis stabilization, assessment, and inpatient mental health treatment in a safe and nurturing environment. Kristen Bagley Jones is a licensed social worker and the program director of the Children's Wellness Initiative, which provides mental health counseling directly in schools to make it easier for children and families to receive the social and emotional help they need. Carol Nash is the director of the Mental Health Research Program at Franciscan Children's and the director of Franciscan Children's Kids Healthy Minds Initiative, a community education initiative designed to raise awareness about youth mental health crises. Dr. Matt Nock is the chair of Harvard's Department of Psychology and the director of the Nock Lab at Harvard University and one of the world's leaders in suicide prevention research. Dr. Nock is a MacArthur Fellow and consultant to organizations like the NIH, the American Psychological Association, and the World Health Organization's World Mental Health Survey Initiative. We are honored to have him join the panel this evening. Dr. Alex Milner is a researcher in Harvard's Department of Psychology in the Nock Lab and scientific director of the Mental Health Research Program at Franciscan Children's, which identifies practices and interventions to improve outcomes for children and adolescents living with mental illness. And last, but certainly not least, Dr. Fatima Watt is the Director of Behavioral Health at Franciscan Children's, leading their integrated team of psychiatrists, developmental pediatricians, neuropsychologists, psychologists, and social workers to provide comprehensive mental health services to children and families. All right, we're going to start briefly by hearing from each speaker on the work they are doing, the trends they are seeing in kids' mental health as a result of the pandemic, and then we'll move on to your questions. Once again, if you have a question that you'd like to add, if there is time for a live Q&A session, please notice the Q&A button on the bottom of your screen. All right, let's start with Dr. Ralph Bonapane. Dr. Bonapane is the director of the McLean Franciscan Child and Adolescent Inpatient Program. Dr. Bonapane, please tell us about your work.
Hi, thank you everyone. Thanks for joining us. The COVID-19 pandemic has been an incredible challenge to all of us to work together to rethink how to respond to our children's needs, both as parents and teachers, but also as community members and healthcare and mental health professionals. We're all trying to do something incredibly hard and rely on each other to invent a new playbook about how to best care for our kids in such trying times. The two programs at Franciscan Children's that I'm most involved in are the 24-hour emergency crisis response programs. And it's the largest program of its kind for children and teenagers. We've provided care throughout the crisis 24/7 to children who arrive in emergency rooms across the state, usually following a suicide attempt, and in need of some very immediate psychiatric crisis. To do that, we gather a team of 150 professionals here at Franciscan Children's and partner with McLean Hospital and Mass General Hospital to work with kids aged 3 to 19 who are in a very immediate psychiatric crisis, usually in the aftermath of a suicide attempt. You'll hear from a number of colleagues about how we've responded in our outpatient programs, in our school-based programs as well. Certainly what we've seen in our inpatient programs designed to respond to immediate crisis is there has been in the last month what I would say is a fourfold increase of kids in psychiatric crisis in emergency rooms needing very immediate care. Our team has really worked to respond to that, but at the same time, really to plan ahead to the near future. We expect that the indirect consequences of the COVID-19 crisis will mean that there's a demand for emergency psychiatric care that will continue to be very high in the coming years. Thank you, Trenny.
Ralph, thank you very much. Next up is Kristen Bagley Jones. She's the director of the Children's Wellness Initiative in Boston Public Schools. Kristen, what trends are you seeing right now in schools as they move back and forth between hybrid methods, in-person and at-home virtual learning?
Well, I think one of the first trends we've been seeing is a lot of social isolation and loneliness for kids that we've already been working with, kids that we're already seeing for counseling. I think that that's a pretty big theme, and it's really impacted kids' daily functioning. And it's the duration of the loneliness that's of concern versus the intensity. And it's, let's see, Boston Public Schools closed, I think, the third week of March. So since then, kids have been pretty isolated for the most part. It's been a long time for all of us, but particularly for them. For some of the older kids, we work with kids from grade kindergarten through grade 8. So we have some older kids as well. As Ralph talked about, we have also seen an increase in self-harm and thoughts of suicide. And also what's really concerning is we've seen a trend around risky behavior on social media. Kids are at home all day, they're on social media, and we've seen some increased trends around that. The other thing that we've seen is the daily control is not, kids are not in control of their daily life, just like we aren't in control of ours. Their worry becomes larger, their anxiety gets more pronounced, and the lack of energy and enthusiasm, especially for some of our older kids who already have some depressive tendency, has also become a trend. The other trend that we've seen is, on other natural disasters, or like at 9/11, we were able to give each other a lot of support. People were able to gather into groups and be socially supportive. And we can't do that right now. And that's been really difficult for our kids who are stuck at home and not going anywhere else. And then some of the challenges, because Boston Public Schools closed back in March, we really haven't been back since. And so we've gotten very good at remote and providing our services on remote, but that's also a challenge. Providing counseling services not in person has been difficult, and something that we've worked on. Did that answer your question, Trini?
Yes, it does. And I know we have more questions regarding that topic as we move forward. So thank you very much, Kristen. We appreciate it. We're now going to turn to Carol Nash. She is the director of the Kids Healthy Minds Initiative and Mental Health Research at Franciscan Children's. Carol, can you tell us about the initiatives right now, these very important initiatives during this time?
Thank you. And thanks to everyone for joining us this evening. Some of the things that we're doing, it's really important. It's important to these kids. The Kids Healthy Minds Initiative is a mental health education program. It's similar to Kristen's CWI program, where a lot of what we do is in the schools, but we're spending more time educating teachers about kids' mental health and educating parents about it. We are trying to increase awareness about the youth mental health crisis. You heard those staggering numbers earlier, to promote early detection and to reduce the stigma that all too often accompanies mental illness. At Kids Healthy Minds, we believe that both parents and teachers are frontline in tackling the youth mental health crisis. So our clinicians travel to schools, although right now we're doing Zoom, to meet with teachers, parents, and we even meet with students to educate them, but most importantly, to teach them about resiliency, to learn resiliency before a crisis develops. Resiliency isn't inherited, it's a learned trait. And if we have time, I'm happy to talk about resiliency skills later in the meeting if anyone is interested. I do want to mention that the Kids Healthy Minds was started in partnership with the Diocese of Boston, and it's been a tremendous help in getting the doors unlocked for us to be able to get into these schools to meet with teachers and parents. Playing off what Kristen had said, the stress and isolation that kids are feeling, teachers are feeling the same thing. So we're now starting to develop a webinar and programs to best support teachers so that they can take care of themselves to help take care of the kids. My other role is the director of mental health research. Our program is only 7 years old and it is doing so well. Franciscan is committed to research to help improve the outcomes for children and adolescents, particularly many of our kids who do experience suicidal thoughts or behaviors. As Trini mentioned, we formed an exciting and very successful partnership with Harvard University to advance the field of adolescent suicide research. And I'd like to now introduce Dr. Matt Knock and Alex Milner. And they'll give you more information about the really important and exciting research that we're doing.
Carol, thank you. In TV, we call that the perfect segue, getting us right into the research portion of the evening. We are going to begin with Dr. Matt Knock. He's the director of the Knock Lab at Harvard University. Dr. Knock, can you tell us about your work and the trends that you've been seeing since the beginning of the pandemic?
Sure. Thanks so much, Trini, and thanks, Carol, for the perfect segue, and thanks everyone for joining this meeting. So I'm fortunate to run a research lab at Harvard in the Department of Psychology, where we're focused on really trying to advance the understanding and our ability to predict and prevent suicide, especially among young people. As Trenny mentioned earlier, suicide is the second leading cause of death among young people. And in terms of trends, before the pandemic, we've seen increases in youth suicide rates and in special subgroups among adolescent girls, among Black youth. The suicide rate has been increasing in recent years. And there are, as mentioned, concerns about increases in suicidal thoughts since the beginning of the pandemic, among many other health problems. Pre-pandemic, in terms of trends, we also have seen huge increases in the availability of various technologies, smartphones, wearable watches, biosensors, kids using social media platforms much more than ever before. Then the pandemic hit, and concerns about mental health, as people have mentioned, have really skyrocketed. But we've also seen a huge acceleration in the uses of these newly available technologies to better understand, predict, and reach kids who are at risk. And this confluence of factors is really revolutionizing not just the way we do research, but the way that we provide treatment. For instance, we're working in this exciting collaboration between our group at Harvard and Franciscan Children, trying to take some research and combine it with the best clinical care kids can get. We're starting to try and better monitor kids at high risk. Often when kids are treated for suicide risk, there's a big drop off between what happens in the hospital and then what we're able to do outside the hospital. And we're now able to take advantage of the availability of smartphones and biosensors and social media platforms to, again, not just understand, but better monitor and intervene when people are at risk. So there's a big trend towards using new technologies to really try and accelerate our ability to help kids who are at risk when they're at risk.
Dr. Knock, thank you very much. It's amazing that you guys use that kind of technology. I know Amazon now is coming out with a new item, and I can't wait to hear you guys talk more about this, that will actually analyze your voice and your interactions with people to help determine what you're feeling and where your emotional state of mind is at that time. It's pretty incredible. To continue this topic, we're going to hear now from Dr. Alex Milner, who's the Scientific Director of Mental Health Research at Franciscan Children's. Dr. Milner, can you tell us more about why research is important for our children's mental health?
Yeah, absolutely. And thank you again. And thank you everyone for being here. So mental health research is so important because it's really our best way to advance what we know about mental health so that we can make better treatments and interventions and try to improve the mental health of our patients at Franciscan, but also in the mental health of everyone in general. You know, to draw an analogy to something that I think is on everyone's mind right now, I'm sort of going to use COVID-19 as an analogy for kind of what we do. So because there's a lot of overlap between what we do as psychological scientists and medical science as well. So when COVID emerged, there were decades of basic research on genetics and viruses so that scientists were very quickly able to understand exactly how how COVID infected the body. And then that information was passed to pharmaceutical companies, and they used that understanding to quickly develop, ways of figuring out how to stop the virus from infecting the body. And so in mental health research, we do much the same thing, but obviously we don't use microscopes and we don't deal with cells, right? Instead, we use things like surveys. But as Matt mentioned, as Dr. Knock mentioned, we do things like we do surveys on smartphones. So we're trying to reach people out where they are in their daily life. We also have done things at Franciscan that kind of allude to what you just talked about, Trenny. We've done also kinds of monitoring, physiological monitoring, where people are wearing bracelets that are measuring their heart rate, their skin conductance, physiological signals from their body. And we ask them to tell us when they're feeling more emotional, when they're feeling more distressed. And then we try to use those signals from the body to predict when kids are saying that they're going to feel more distressed. And can we intervene early in that process so we can prevent them from getting highly emotional. So these are the kinds of new technological advances we're trying to leverage to better understand mental health and, like I said, to better intervene. And the other thing that we do is, just like scientists are testing vaccines in clinical trials right now, we also do that. We test in new interventions and new treatments. So for example, we might give some people a treatment and not others, and to try to assess whether or not that treatment actually helps improve the mental health of the people that are receiving it. So these are, and this just helps us continually improve the care that we can provide at Franciscan, and then we can contribute to the sort of overall scientific literature and hopefully improve the care everywhere. So it's, like I said, mental health research is very similar to the medical research in general. It's more complicated because we're dealing with people and not cells, but the goals are very similar, and we just hope to advance understanding and to test treatments and to improve mental health overall.
All right, Dr. Milner, thank you very much. We appreciate that. Our final panelist tonight is Dr. Fatima Watt. She's the Director of Behavioral Health at Franciscan Children. Dr. Watt, what other trends are you seeing in families' mental health these days?
Yes, thank you so much for having us and joining us tonight. So I oversee outpatient mental health services. Throughout the pandemic, we have seen ups and downs when it comes to the mental health needs of children and their families. Many families, both kids and adults, experienced high levels of grief, which seemed to come in waves. In the beginning of the pandemic, we saw a sharp increase in depressive symptoms as many of the families lost the outside supports and routines that they were accustomed to. Some individuals with anxiety saw an increase in their anxiety, but some individuals felt like they had been preparing their whole lives for this moment, and they were able to use previously taught strategies to help them cope. I've heard both kids and parents say, I've had anxiety my whole life, and now other people finally understand what it's like to be me. I think I'm doing pretty good. But overall, stress was high for both children and their caregivers. As the pandemic continued into the summer, many families adjusted to their new normal. They took advantage of spending time outdoors as much as possible. But with the return of school and the uncertainties for many families, stress, anxiety, and depression has once again really increased. Throughout the pandemic, individuals, whether children or adults, really struggled with the loss of a sense of control, which certainly can elevate stress and create feelings of panic. The experience was particularly heightened for parents of children with special needs, whether those were medical needs, psychiatric needs, or developmental needs. Finding new routines and helping children understand the significant changes that were happening without school and other external supports was particularly challenging. So as a result of the changing mental health needs of the family, at Franciscans, we quickly transitioned to providing services through telehealth. And we also started a number of parent support groups. We really wanted to focus on taking care of the entire family, not just the children. What we found is that when parents had the support to manage their own stress, anxiety, and grief, the children generally functioned better. We also started support groups for adolescents and for younger children to give them a space to express themselves, to learn coping skills, and to give and receive support from peers experiencing similar challenges. Our patients and families have generally responded really well to telehealth services, which has allowed them to stay connected with their mental health professionals, even when we can't physically be together. Some families are receiving multiple services throughout the course of a week, and our goal is to really meet families where they are and provide the level of service that meets the needs of both the children and their caregivers.
Dr. Watt, thank you very much. Don't go anywhere because we're at the question and answer portion of the evening. And the first question that we have is actually directed for you and Kristen Bagley Jones. And it is about something that you just talked about, that, kids are feeling a lot of stress, but so are parents. Parents have fears and anxieties. And the question is, how should a parent express those fears to a child without causing the child extra anxiety?
Yeah, this is a great question. I'll start. It's really important that we are talking to our children about their own feelings and helping them identify and cope with difficult emotions. But we really can't expect our children to learn how to manage their emotions if we don't share with them that we've also felt distress and then model how to cope effectively. So you want to make sure that you're sharing information in a concrete, developmentally appropriate way with your child. It's important to keep information simple, but you can share a little bit more details with other children, with older children and adolescents. For young children, you may say something like, mommy feels sad sometimes. I miss spending time with grandma and grandpa, and I miss seeing them all the time. This is why we talk to them through the computer on weekends so we can see each other, and it makes mommy feel less sad when we have that time together. When we're sharing our feelings and naming them specifically, you're helping your child cope with them, you're modeling for your child, and you're giving them permission to do the same. It's important though that when you name the emotion and share that with your child, that you're also talking to them about what you're doing to cope with the emotion. And that really does help to keep the fear down. We want our kids to know that we are feeling emotions, but we also want our kids to know that we're able to manage those emotions. And let me say that our children are definitely watching. So even if we think we're managing well overall, if we don't sit down and talk to them, then children tend to fill in the gaps and they might misinterpret the reason that you're experiencing strong emotion. And for younger children in particular, they tend to feel that everything is about them. And so if you're experiencing a certain emotion, they're very likely to think that they're the cause of that emotion. And by having these conversations with them, children are less likely to feel blame for the emotions that you're experiencing.
Mm-hmm.
I think that's it.
If I could just add to that, to echo some of what Dr. Watt said, is that kids have very vivid imaginations. And if we don't talk to them about some of the things that are going on, then trust me, they're making up a whole lot more than what is the reality. I also would totally agree that parents all the time say, oh, my kids don't know what's going on. Oh, they haven't heard anything. And I can guarantee you that those little ears have been listening to every single thing in our household. So like Dr. Watt said, to just be kid-friendly, developmentally appropriate with them, but know that they're hearing what we're talking about. That old saying, when you're on a plane, put your oxygen mask on first, I think is so true these days, even more than usual. If you're worried about things, if you're worried, whatever, all of the things you could be worried about, it's where we need to practice the 3 R's, which is what I would say, reassurance. We have to reassure ourselves we're safe. We have to have routines to try to get a sense of control in this very uncertain world. Like even myself, I make myself go out and walk. I make myself do these things to have that kind of routine. And then the regulation of, deep breathing and, all these other things, or maybe some days Amazon shopping might be regulation. I don't know. Not saying anything that I do, but really providing the 3 R's for ourselves before we think we can do that for our children. I can't overestimate how important that is. Same thing goes for teachers, that they're very worried and they're very anxious about things. And they need to also take care of themselves and get the help and support that they need. Thank you.
Kristen and Dr. Watt, thank you very much. The next one, Dr. Bonapane, we're hoping you can answer this and help us with this one. What warning signs should parents look for before seeking help for their children's mental health? Is there a threshold for concern given the baseline stress that everyone is under right now? Maybe even something sooner than we've seen before because of this current crisis?
Well, I think first I would say we could all use some help right now. And I would say lower your threshold for reaching out and asking for help. Not because that it means that there's an emergency, but because it's going to take some extra time and effort to reach out and connect. And that's time well spent for, again, both for you as a parent or as a teacher, but also for your children. And start to explore. I think that schools, communities, hospitals like our own have been very creative in trying to come up with ways to support children and families. So, reach out to find sources of parent support groups, reach out to find sources of good mental health information that aren't just the general news feed. Reach out to see what your school, your mental health center, and your pediatrician have to offer. Each of these places have put together things that could be supportive to you or to your children. And it's better to reach out earlier to see what's available. There's certainly good online portals. Franciscan Children has a mental health resources link that has a lot of potential sources for parent support or moderated child discussion blogs. Few examples would be the Parent Professional Advocacy League, ppal.net, is a great source for parent support groups and youth support groups. There are mental health screenings that you can find the links on the Franciscan Children's resource page. There are sources like American Foundation for Suicide Prevention or the MGH Clay Center for Healthy Young Minds that are also great resources for information or concerns that you have. I would also say those are good sources to find a peer group to talk about what you see. Is it normal? Do I need more help? To compare, contrast with what teachers are observing, what other parents are observing. It's also important to know some of the basic signs that you may need emergency help for a loved one or a child. And those sites are good information for those, but knowing the basic warning signs of suicide, if your child or a loved one's talking about death, dying, or suicide, if they're talking about feeling hopeless or worthless, if they're saying things like they don't have a reason for living or they'd be better off dead, or other dramatic changes in their behavior or mood that might want you to reach out more immediately. Pediatricians' offices can be a good source of crisis advice. Emergency rooms do crisis mental health evaluations. The back of your health insurance card for almost everyone has an emergency behavioral health hotline. And then there are national hotlines that, like the National Suicide Prevention Hotline, 1-800-273-8255, that can be sources for immediate help if you're concerned.
Dr. Bonapane, thank you very much. And just a personal aside, I know sometimes reaching out for help for yourself or your child can feel difficult. You're not sure if you want to take that step. I always feel that sharing stories is really important in breaking down the stigmas. And very candidly, just last week, I called my EAP, which is our employee assistance program. And I said, listen, winter's coming. I have seasonal affective disorder. My anxiety's been high. I think it'd be a good, time for me to speak with someone and start to work through these before it snowballs, to use a terrible pun there, into winter and things literally get darker. Just to sort of nip that in the bud, because if you get ahead of it, it doesn't always get as bad. And there are a ton of resources out there. Also with the state of Massachusetts, which has recently started, the Department of Mental Health has a hashtag more to the story, really encouraging people to reach out for help during this time and offering resources. Dr. Bonapane, I want to also bring in Dr. Knock with you about this. Social media platforms, a lot of us are on our phones, on our computers, a lot more these days, especially our kids. Parents wonder if screen time is the right thing. Are they a help or a hindrance to a child's mental health during this crisis? And should parents be concerned about that increased screen time during the pandemic? Dr. Bonapane, if you want to go first.
A couple initial thoughts. The internet and social media can be both a source of connection, especially when some of our connections we can only connect to virtually. And a source of information, but then also it can be a source of anxiety or magnify fears. And so I think that balance is the key. And as a parent, I think that what we try to do is build in a daily routine. Kristen spoke about this, the importance of a routine. And I think building in a routine where you're balancing the time that the child and yourself are on the computer, with particularly where you can try to reach out socially on the computer for virtual social support, but then also with some safe personal face-to-face support, and then balance that with the things that computers don't do well, which is scheduling time to walk outside in the daylight, scheduling time to get exercise, scheduling a sleep routine that involves some time before bed away from the computer, and some comforting time. And then also thinking about nutrition and eating, and being sure that for kids and family that you find a new routine and balance in that.
Dr. Knock, would you like to add to that?
Yes, thank you. If I could, I want to come back, Trenny, to just say thank you for sharing the personal anecdote. And I think it's so important for us more generally. There's still so much stigma about mental health, about suicide, and there's so much fear that if we talk about these things, we're going to make people more anxious, more depressed, more suicidal. And there's very clear data that that is not the case. Talking about these things with our children, with youth, does not make them more distressed, does not make them more suicidal, does not make them more likely to engage in the behaviors we're asking about. So I think it's important to share that as you did. So thank you for modeling that. And in terms of is social media or smartphones a help or a hindrance? Yes, they can be both. There's been some research, some suggestion from research studies recently that there has been an increase in reports of suicidal thinking and suicide risk among youth in the past few years. It must be because of smartphones. It must be because of social media. That's very speculative. There's also been individual level research looking at thousands of kids suggesting that hours of screen time is about as harmful as amount of potatoes that kids eat. The truth is, it really depends on what you're doing in these interactions. Online interactions we can think about as just like in-person interactions. And as Professor Bonapane was saying, they can be good, they can be bad. It really depends on what's happening during them. Let me tell you quickly about two research studies that have been done recently at Franciscan Children with our group at Harvard. In one, we've been monitoring kids who have suicidal thoughts with smartphones. And we're also monitoring a sample of adults. And we've been doing this since before the pandemic started. So we're able to look at what has happened during the pandemic. And in both groups, we see we have a GPS tracker with people's permission. We see people are spending more time at home, not surprisingly. We see that as people have spent more time at home, they're reporting much more social isolation. For the adults, that social isolation predicts significant increases in suicidal thinking. For the adolescents, that's not the case. We don't know why. We're digging into this. What is it that might be protective among adolescents? One of our hypotheses is it might be that kids are more connected through their smartphones. They're talking to other kids, they're reaching out, they're on Snapchat, they're on TikTok, they're messaging each other, and maybe that is protective. We actually have data that we're going to look to see if that's the case. And there's also variability. For some kids, and as for some adults, their suicidal thinking, their distress has increased over the course of the pandemic. And for others, it's come down. So it's not always so easy as social media is bad. In another study, we did an in-depth analysis of a number of families, other children receiving treatment at Franciscan Children's, and we asked them about social media use, and we looked at social media use with them, and we found that for the vast majority of youth, there's both negative and positive aspects that mirror what happens in-person social interactions. Kids report on the negative side a lot of social comparison, a lot of fear of rejection, a lot of engaging with self-harm content, a lot of cyberbullying. On the positive side, though, there's a lot of social connectedness, social support, shared interests. Kids are accessing resources for mental health services. One consistent finding was that youth reported not really learning how to engage with social media from schools, from teachers, from families, from clinicians, from us as clinicians. And so one thing we're doing is building on these findings, trying to build a guide for clinicians that could be used more broadly about how to work with kids to engage in social media in a healthy way, so we can help them get more of the positives and less of the negatives.
Dr. Knock, we're going to bring in Dr. Milner as well for this question, sort of a follow-up to this one. I mean, we've talked a lot about our sort of daily lives and how we use social media, the good and the bad, but it's also a really productive tool in research. How is your research using technology to advance the field?
Matt, do you want to go?
Sure. So I will start, and Alex, if you want to jump in. So as I was just describing, we're using smartphones to better monitor youth and adults during the transition from hospital care to outside of hospital care. That transition is a really big a time of very big increase in risk of suicide attempts. And so we're trying to monitor people during that time, hitting them with surveys several times a day to check in and see how they're doing, really brief surveys. And we're finding that we're able to better find people at risk when they're at risk. And we're also not just monitoring people, but reaching out to help them in various ways, and building apps that can intervene and serve kids when they need them. For instance, we have one app that we developed that is a game-like app, sort of like a matching game that you play when you're a younger kid, matching Sally's face with Sally's face. But in this game, it conditions people to have an aversion to the idea of suicide or self-injury. And across 3 different experiments, 3 different randomized controlled trials, we found that people who had access to this app and used it showed significant decreases in their likelihood of suicidal behavior and self-injurious behavior. We've built another app that interacts with social media platforms. You mentioned, Trenny, Amazon. We're working with Amazon Web Services to improve our ability to find people on social media platforms at risk for suicide. And then in other work with a different social media platform, experimentally tested out a bot-like app that refers people to help, to crisis lines. We can use this for referring people to connect with others, and found that this automated bot, which is really scalable, increases by about 25% people's likelihood of actually reaching out for care. So the idea is a number of examples like this. The idea is we're still using the field, the hospitals, Franciscan Children is still using in-person care, and it's still needed. But now with advanced technology, we can use smartphones, we can use voice samples, as you mentioned, we can use social media data to sort of, in a responsible way, meet people where they are and get them the help they need when they need it. Because when people are engaging in behaviors like alcohol use, drug use, violence, suicidal thoughts and behaviors, these things don't just happen once a week in that hour you see your clinician, if you're lucky enough to do so. They happen in a really episodic way. So we as psychologists, psychiatrists, mental health clinicians and researchers need to really use the tools that we now have at our disposal to revolutionize the way that we're able to provide care.
Yeah, and so just to build on that, and a couple more examples of things that we're doing in this same line. So we also have been looking at, you mentioned, Trenny, that Amazon is using, the voice data to try to predict these signals. I mentioned the bracelet that measures physiology, but also, Google and Apple and all these companies are using these large, vast amounts of data that we have on these smartphone devices to sell us things or to get us to use their products. Well, we're trying to understand, can we use those same sources of data to predict whether mental health is declining over time, and whether or not we could, similar to the wearable device, intervene early. And so we have been looking at, for example, text messages that come in, not necessarily the content, but just the duration, the length of the messages, or if I send somebody a message, do they send it back to me, and how often am I responding or not responding? And we found some signal in there that suggests that as people approach hospitalization at Franciscan, they stop responding to the messages that are sent to them. And so that could be a signal of sort of declining mental health that, again, we could use to just amplify and try to understand, should this intervention happen? Can we intervene earlier with this person? Same idea with the physiology smartwatch that I keep mentioning. If this line of research progresses, could we understand and could we then communicate with someone's smartphone? Hey, it looks like you're really distressed. Here are some skills maybe that you've worked on in therapy. Maybe now is a time to implement some of these skills. Can we give you some examples of things that you might want to do? We're not there yet where we can know exactly the signals to send that, but that's the sort of down the line and the vision that we have of, as Matt said, meeting people where they are out in their life, but giving them sort of tools and ability to help themselves and to intervene when necessary.
Mm-hmm. Kind of nice to know not all technology is terrible. As a total tech junkie. Dr. Watt, I've actually got 2 questions for you. The first is if you could address the particular needs of children who are not neurotypical, specifically those with Asperger's, who may already suffer from depression and that difficulty of sort of fitting in, the needs and the challenges and how we can face those.
Absolutely. So children and adolescents who are not neurotypical have been especially challenged during the pandemic. For many, losing the structure of the school day. Many have lost the ability to have in-home therapy supports, and the loss of predictable routines has caused significant anxiety and angst. And this is particularly true for individuals on the autism spectrum, where routine and predictability allow them to function at their best. Changes in routines and caregivers, reduced structure at home, not knowing what to expect can all increase the stress in this population considerably. So if your child has autism or another developmental disability, you may notice increased rigidity, increased repetitive behaviors, or more irritability and tantrums. You may notice more difficulty moving on from challenging moments, more social withdrawal, increased reliance on their special interests. This response can be especially exacerbated if caregivers are dividing their attention between caring for the children and work or other responsibilities. School and remote learning has really been a substantial stressor for families who have children who are not neurotypical. The hybrid model can be really confusing for kids to keep up with and can cause a lot of stress. This is what I'm hearing from my patients most often, is that they feel really confused. Children with delays need more explanation, they need more repetition, and they certainly need a lot more reassurance than some of their neurotypical peers. So I would say it's really important to talk to your children as much as possible, especially about scheduling. Preview the day with them in the morning or the night before. Prep them for any known changes that will be coming in their schedule. For days where a child might be remote learning, and perhaps even on weekends if needed, implement as much structure and routine in the day as possible. Creating a schedule can be a really fun activity that you can do with younger children. Older children might want to write out their schedules, but also build in flexibility where possible. I think within the COVID pandemic, flexibility is the name of the game because so much is changing. And the more flexibility that we can help our children learn, the more resilience we can build. So for example, creating a schedule that's based on the order of activities rather than the time of day can really help provide structure while also leaving some flexibility for the entire family. It's also important to remember, like I said, that your child may need extra words of reassurance, more explanations about what's happening, and more comfort and physical contact, such as hugs. Yeah.
Dr. Watt, thank you. And then one additional question that I'm sorry that I'm like leaning so far into my camera, but it's in my little chat area and I don't have my reading glasses with me. It is, someone wrote, I have found that in addition to helping my children with disrupted routines and social isolation, my preschooler is exhibiting increased levels of anxiety and describes herself as nervous at preschool, which is in person, and is uncomfortable socializing there. How can I best support her?
Yeah, we're actually seeing this quite a bit where kids are a little bit more anxious and a little bit more nervous at school for any number of reasons. The first thing I would do is to really talk to your 3-year-old and find out what nervous even means to her. That might be something that she's heard an adult say. And so we really want to understand what that means for her and talking to her about how she's feeling. A lot of kids, even children as young as 3, can really feel out of control during this pandemic. And so helping her find ways that she can have some control in her environment can really help decrease the anxiety in school. So for example, helping her to build a hand washing routine that's especially for her, helping her to set some boundaries with peers or even with teachers if she feels like someone's getting too close to her. What are the words she can say to say, I need a little space, and being able to practice that in a really fun way. All of those things can really help her feel like she has much more control over her environment, which can decrease anxiety.
Dr. Watt, thanks. We'll give you a quick breather. We're going to ask you to comment on this next question as well, while I'll go to Kristen Bagley Jones first. Kristen, the pandemic is affecting communities of color disproportionately. How are you reaching those patients, Kristen?
That's a great question. CW, Children's Wellness Initiative, is only in Boston Public Schools, and the majority of our families are of color that we work with. So we see a lot. I would say, I almost would call it a second pandemic, the racial trauma that kids of color and their parents and families are going through. They're dealing with COVID worries as a pandemic. And then in addition, they're worried about what's happening in their own lives, and they're worries about their family members out in the community. They're also worried if their parents are essential workers. I think about the folks at Franciscans who are essential workers, and kids who are worried about them. So putting together the racial pandemic so to speak, and COVID pandemic, I think has been a lot of heavy lifting on kids and our families. So what we try to do is work in our clinical practice as much of that awareness as we can. We work closely with Boston Public Schools administration around the efforts they're taking to deal with social justice issues. And we're trying to do the same as much as we can in our own sphere of life in Boston Public Schools.
Dr. Watt?
Okay, yeah. So we are in outpatient are working really hard to be flexible in our approach when working with communities of color. With telehealth, we're able to offer more options for sessions. Not all families have access to stable internet, so we offer phone-only sessions if possible. For a lot of our adolescent males, they feel a lot of anxiety and pressure when face-to-face on the screen with the clinician, and so being able to offer them the opportunity to turn the screen off while still engaging in clinical conversation and meaningful therapy has been really helpful. We take most insurances, including Mass Health, which really allows us to treat families from a range of socioeconomic statuses. One thing that we've really thought hard about is how we safety plan, both with COVID and with the social justice issues that are on the forefront. We've had to think about how we safety plan, particularly for families of color. Thinking about going to the ER and what's the level of risk. For many families, that's a really scary thing to go to the emergency room for a mental health crisis in the context of COVID-19. One of the things we've also really thought carefully about is when and how we call the police for assistance for a mental health crisis. So we've had to be much more flexible, but that has also allowed us to meet families where they are and to make sure that they're comfortable and they're able to use their safety plans as intended. Another thing that we've done is the creation of groups in response to the community's needs. We had a number of Black and Brown youth who were struggling with minority stress. So we created a group, they call themselves the Gen Z Justice Group, and it's absolutely amazing. Each week the group goes larger, the kids are engaged and they're interested, and we've certainly gotten a lot of positive feedback from the parents and other family members of the youth who are participating. So we really try to pay close attention to the needs of the community and structure our programs to provide as much much support as we're able. And lastly, we're checking in to make sure that families know that there are resources in their community. We partner with agencies such as the YMCA and the Alston Brighton Collaborative. And through those partnerships, we're able to have a sense of the emerging needs of the community. As I've mentioned before, we really do try to meet our families where they are. For some families, they can't even start to focus on their mental health because they're worried about food and worried about other basic needs. So we've really tapped into resources in the community to help connect families appropriately. For example, we're working with a Middle Eastern family right now who's in serious need of resources. They're limited in their ability to use food banks because of their special diet. We were able to connect them with the Muslim Community Center. We filled out a scholarship application with them, which they were granted, and now they're much better connected to the community. They have their basic needs met and they can focus on working with the schools. We can work with the parents and the other children in the home to really focus on the mental health for the entire family. So for us, mental health treatment means taking a step back, looking at all the factors that are contributing to a family's struggle. Sometimes it's internal issues and sometimes the issues are more systems-based, but we walk with them through all of this so that the family system can function as optimally as possible.
Dr. Watt, Kristen, thank you very much. We're going to bring back in Carol Nash to address the next topic. Carol, I think a lot of people are looking for ways to use this time to build some positive skills and patterns. How do you build resiliency in our children in this current climate?
That's a good question. And it's something that we all need. As we've heard from everyone tonight, parents need it, teachers need it, and kids need it. Unfortunately, the best time to teach it is not when you're in a crisis, but there are still things that you can do. And we've heard some of them tonight, but let me see if I can try and pull them together for us. One of the things that I preach about all the time, and I think is the most important, is a good sleep schedule. We all know that without good sleep, the next day is not our best. For these kids to be staying up late, whether it's a school night or a non-school night, for them not to be getting the sleep that they need, You know, Dr. Knock has certainly done published research about the influence of poor sleep on suicidal thoughts and behaviors. So if you can just look at a consistent sleep schedule for your kids, again, that same routine, healthy eating, which we mentioned before, regular exercise, preferably outside, scheduling family screen-free times. It's not just, no, you can't be on the screen now, but have an alternative. Identify a family time where everybody puts the phone down. You're telling your kids not to be on the screen all the time. Put your own phone down, especially during dinner. I mean, dinner should be a phone technology-free time. And then the other thing, especially with the election now and all the news that's going on that's so disheartening, take family news breaks. And that means breaks, whether you're watching it, reading it, or discussing it. Just take a time to breathe and not have to fix the world. The other thing that we do is to intentionally build coping skills. You know, managing strong emotions is a skill. I mentioned that before. It's not an inherent trait. You have to teach or learn how to do it. So help your child practice the self-soothing techniques that we might know as adults and tailor them to your individual child. Is it deep breathing, yoga, music, prayer, art, journaling, all the things that we hear? Figure out what's best for your children. And that question about the younger children, there's something that we do that we teach the kids. We call their hand their starfish, and we ask them to trace their starfish and to focus really hard on their hand, breathe slowly while they do it, count their fingers if they're old enough to do it. And then once they sort of have that skill, we remind them that no matter where they go, they have their hand with them so that they're always safe to manage their anxiety. Practicing positive self-statements. It's so easy to hear what's wrong, to practice to say what's wrong, to think about what's wrong. Even what I'm trying to do with myself is not think about what we can't do this winter, but instead every day try and think about what can I do today that if I was commuting to Boston right now, I wouldn't be able to do. Practicing positive self-statements is Dr. Bonapane has talked to me about this so many times, where you have the I am, I can, I have a good family who loves me, I'm doing the best I can. It doesn't mean you're doing great, but you're doing the best you can. And we joke and say anyone that you speak with now during the pandemic, if you say, how are you doing? And they say they're doing great. Well, we know they're not being forthcoming because that's just, nobody is. Saying things like, I'm a good kid, you know, pointing out your child's strengths, praising effort, not just achievement, to bolster motivation and sense of self-worth, especially if they're a student who is a really good student and they're not having those opportunities now to demonstrate, you know, I'm good, I'm getting an A. Well, they're not having all of these tests. And be specific in your praise, not just you're great, but boy, you are really good at holding the door for grandma or being patient with grandma or whatever. And then, you know, certainly we talked about teaching mindfulness around screen time and social media. And then the last thing that we always try and mention in Kids Healthy Minds, we do a lot of this teaching resiliency, is mistakes happen, and that's okay. And when your child makes mistakes, it helps them develop problem-solving skills, perseverance, and resilience. Let them fail sometimes. And one of the things that you can do is model handling your own disappointments well. Again, like Kristen says, they're watching, they're listening, they see how you're handling things, and they're going to respond likewise.
Carol, thank you very much. We're just about out of time. So I'm going to go around to all of our panelists, and Carol, we can start with you since you're up. Just a couple of quick coping tools that have worked well for you, and on the mention of sleep, because the time transition and everything, how we can easily make that transition as we turn the clocks back and it gets darker earlier.
So again, I did mention sleep, and we've actually done research on sleep. It is, and we're doing more. It is so important. Make a plan. Talk to your kids about it's going to be a change. It's going to be harder to get to sleep. I am a strong believer in bedtime stories. I wake up at 2 a.m. and my mind starts, and I listen to a podcast called Nothing Much Happens. And it's bedtime stories for adults. And they're just calm stories read by this woman with this calm voice where nothing much happens. But there's also the Calm, CALM app, where they have stories for adults, but they also have bedtime stories for kids. And you can I listen to it with earphones, and I never hear the end of the story.
Anyone else want to offer any last words of wisdom? You can just jump right in.
I would add to what has been said already: sleep, diet, exercise. I mean, they're really, really basic things, but the science behind each of them is tremendous. For sleep consistency, going to bed and waking up the same time every day consistently has been shown to lead to much better mood, much better functioning. Phones have apps you can set or toggles you can set to tell you when it's time to go to bed and wake up, and it makes a huge, huge difference. Healthy diet, if you can, is associated with much better mood, or when you opposite direction with depression. There's a huge literature on this. And exercise. Regular aerobic exercise a few times a week is as effective as
We're losing Matt.
Well, I can jump in until he comes back. One of the things that I think COVID does present is an opportunity for us to be able to teach gratitude to our kids. We're very used to making sure that they say please and thank you, but I think here, when there's so much suffering around us, there's really an opportunity. It's not just think on the bright side, but it's really about taking in the small moments, the sound of a baby laughing, the sight of a bird in a tree, really being able to teach our kids to appreciate the small things. When children are more grateful overall, they end up turning into happier adults. And so while the COVID-19 pandemic does present its challenges, there are also opportunities here that we can start instilling in our children to help them become more resilient, happy, fully functioning adults.
If I can just add to that, one thing I talk with kids about is try to remind them of a strength they have and make it real. Like not just a made up strength, but something they really own it, that it's a strength of theirs. And then to make a plan with them for the future gives them hope. Like even just say, we're going to go visit in 3 months, or we're going to go watch this movie, or to plan forward is also something hopeful for them to think about. So strengths and hope is what I would say.
And I think two things that have been mentioned previously, and I'll just mention them again because I think they're super crucial, and it branches off of what Matt Nock was saying, which is people have talked about routine. I think, in terms of all those habits that Matt was talking about, in terms of sleep or eating and exercise, what that all boils down to is just having a routine each day where you get in the habit of doing these, having these healthy habits. And the other point that I think Kristen made previously is just, and Fatima, is just open communication, just talking about things, being open with your child, and trying to understand what's going on with your child, whether they're 3 years old or 17 years old. Just trying to, I understand that adolescents can not always be the most open people, but just trying to communicate and keeping those lines of communication open is I think great.
Okay, well, thank you to everyone. I know this was aimed at helping our kids, but at least that last portion I think was helpful for probably everybody that joined us tonight. And a huge thanks for all of you who took an hour out of your evening to participate in this. And also, Carol said mistakes happen. I made a mistake earlier because apparently reading, one of the few jobs I absolutely have to do every day, I didn't do so well. I want to thank John Nash. I gave you a whole brand new name at the start of this, the president and CEO of Franciscan Children. Thank you very much. Listen, reading is hard, kids. Reading is hard. We'd also like to thank a couple of state legislators who were on this call today, Representative Kevin Honan and State Senator Brownberger. We appreciate that you took some time to listen to all of this and understand and have made a commitment to bettering mental health care and access for folks. We'll let you go in just a second, but just a reminder that we're not navigating this uncharted territory alone. Places like Franciscan Children's, McLean Hospital, Harvard University, they're in our backyard. They're working day in and day out to ensure that children and families are better equipped to meet the challenges of youth and mental health crisis we're all facing. The pandemic has obviously made these needs more pronounced, but there are resources and experts out there to help us all navigate these uncharted, choppy waters. Thank you to everyone who submitted questions and attended the panel. As a reminder, we're going to send out this session in full, a link to it. We hope that you're going to share it with others that may be able to benefit from it as well. And I'm told that I can tell you guys to good night and good sleep. It's almost bedtime, 10 o'clock.
Good sleep. Thank you.
Hi, everyone. Thank you so much.